Good morning.
Hey, Doc. Good morning. How are you?
I'm doing well, thank you. How are you?
I am doing well. I know a lot of things have changed right now, and physicians are finding themselves in various positions doing different things. And so I wanted to talk to you today about your practice and what you're doing. Tell us more about the emergency relief services that's going on in your office right now.
Sure. So we started a campaign called Gotta Cut, Get It Shut. And the idea is to try to offload some of our local emergency rooms and urgent cares. So right now in the low country, we're doing okay. We're not New Orleans or Louisiana, we're not New York, but we know this thing isn't really stopping anytime soon. So, in anticipation of more cases, the more people we can keep out of the ER that don't need to be there, the better for everybody, really. So, yeah, the whole idea is if you get a minor laceration, a cut that might need some stitches, a small abscess that needs drained, a burn wound, something of that nature, that we would love to take care of you in our office rather than you having to go to the ER, using up supplies and ER personnel, exposing yourself, and trying to keep us out of the ER too. So, really, it's kind of a win 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 for everybody.
So, how would someone know whether to come to your offices for their burn or laceration or if they should go to the ER?
Yep, great question. So the best thing to do is to start by giving us a call. So we're at 843-815-6699. And from there, we will triage you almost like an ER. So we'll ask you a few questions, and then we'll probably either set up a telehealth appointment, just like we're doing now, where I can actually see the patient remotely, or you can always send photos through our secure email. So that allows us to see what's really going on, and pretty quickly we can say, oh yeah, we can take care of that here, or why don't I meet you in the ER? So yeah, it's best to give us a call so we can figure it out before you just show up to the office.
Okay, and tell everyone where your office is. And I know you have two offices, and are you doing this at both offices?
Yep, we're doing it in both offices. So we're open Monday through Friday, 8 to 4:30 right now, so kind of shortened hours. And we're at the Bluffton office at 7 Mallet Way, just behind Jim and Nick's off 278. And our Beaufort office is off Rebo Road, pretty close to the hospital.
Okay, awesome. And how does the transition from the ER to your offices actually work?
Sure. So if a patient does actually go to the ER or an urgent care, someone there is going to triage them. So if they feel like, this could really easily be taken care of in an office, they may ask you to set up a time with us. So they would help coordinate. They would give us a call. We don't want you to leave the ER premises without connecting with our office, because we don't want you to be driving all over town. But yeah, the ERs know how to reach me, and they'll be giving you information so that you know where you're going, how to get to us, and we would know that you're coming. We also don't want an onslaught of patients, so we don't want 10 people in the office who all need something right now. So we're going to try to set it up so that we have as few people in the office at a time as possible.
Dr. Klinke, you're a plastic surgeon, and so please tell everyone why they would come to your office for this type of injury. Because don't plastic surgeons get involved anyway from the ER?
Almost all the time. Yep. So a lot of times, traditionally, what happens is the ER will call and say, I've got a patient sitting here. I think we need your help. And I pack up my bags and go meet you in the ER. So this is just sort of a shift in locations. It's the same providers providing the same services, just in a different location to try to minimize risk for everybody and preserve resources too. I mean, the ERs right now around here are doing okay. But the last thing we want to do is take up a bed that someone might need. And the ER personnel they're starting to feel it. They're working a lot of extra hours, and people are working in different parts of the hospital where they don't normally work. So there's a lot going on, shifting and changing, and this is just sort of our way to try to help.
So that's wonderful. Tell me who is eligible for telehealth and coming to your offices, and let's talk about insurance and that kind of thing.
Sure. So telehealth right now, we're using it for as many patients as we can. There will be patients who we have to see in the office, and that's why our doors are open. So these things, acute wounds that need to be addressed, obviously right now, those we need to see. Or let's say a patient had a procedure and they need sutures removed, or let's say they have a skin lesion that's come up and it's bleeding, something that we need to actually physically do something for you. We're going to want you to come to the office. So again, we're trying to set it up so that our appointments are spaced out. You're waiting in your car and going straight to an exam room. There's no waiting room. There's no more magazines. There's no more coffee stand. We're trying to keep it as safe as we can. And then the telehealth appointments really apply to a lot of our folks. So let's say you have a skin lesion that came up, but you're worried, but not too worried. It's not causing you harm. It's not bleeding all over the place. Give us a call so we can take a look at it via camera and come up with a plan. And that may be, hey, let's set you up for an appointment in 4 weeks so we can check in and then reassess. Or we've had patients call and say, I'm sitting at home and I'm looking at myself in the mirror and my acne is just terrible. Hey, we've got time and you've got time. We're happy to see you remotely, but we don't need to see you in the office for that. So we can actually see what's going on, prescribe medications. We're actually doing curbside pickup just like a lot of the restaurants are. So if you need a skincare product, or let's say you have rosacea and you really need your Retin-A, otherwise it's going to get out of control, no problem. We'll take payment over the phone and you can swing by and pick it up, and you do not have to come in the office, exchange a credit card with somebody. So, we're kind of taking all the precautions that we can and limiting appointments, but the telehealth has been amazing. It's actually a really neat idea. We used it previously for patients who, let's say they lived out of town and wanted to come stay in Hilton Head and recover from their cosmetic surgery. That's sort of how we used it in the past. So we're just expanding how we've used it before.
And Dr. Klenke, this is a new phrase that everybody's using, telehealth. And tell us a little bit about that. It seems like it would just be telephone, but I know it's like all different types, but it really can be for anyone at any technology level, can it not?
Absolutely. It is so easy, and our office walks you through it. So all you need is a computer or a phone, and usually any smartphone will do it, that has a camera and a microphone. So that way we can see you and talk to you. So it's super easy. We send you instructions. If people are confused, our staff can actually walk you through it on the phone. And right now, our electronic health records, so where we keep all of our information on patients, actually has its own platform. So that way, if we take a screenshot, let's say, of something that you're trying to show us, it goes straight into your chart. So it's an easier way for us to keep all the information in one place and to keep it safe, but also be able to see you and hear you and talk to you.
That's wonderful. It's amazing what we can do and what we can do to help get through this time, which isn't going to last forever, but right now things certainly are different. Dr. Klinke, is there anything else you'd like to say?
We just want everyone to, kind of do what they can to stay home. It's really hard, and I think as the weeks press on, it becomes harder and harder to stay away from your friends and to cancel dinner parties and cancel graduations. But I think it's really going to be important for us to try to slow the process of this virus. And I think it's probably going to be a little while before we see the end of it. But of course, you're right, it will end. And people just have to sort of do what they can to stay safe and try to protect themselves.
Well, thank you for doing your part in this with Pinnacle Plastic Surgery, and we appreciate everything so much. Thank
Thank
you.
you. I appreciate your time.
Thanks. Okay, so that'll be